A 60-year-old woman complained of tearing and pain in her right eye. She had no history of trauma or surgery of the eyelids, nose, or sinuses. She had tearing and discharge for several months. Recently, she had developed a painful red lump near the right inner medial canthus. An examination showed her vision to be 6/6 on both eyes. There was a reddened swelling over the right lacrimal sac. An examination shows the following finding. Alright, so in regarding to this case, the case is very, very simple. When you look at the picture, and you look at the symptoms that the patient is complaining, the diagnosis is going to be acute Dacryocystitis, meaning there's inflammation of the lacrimal sac. And not just inflammation, this inflammation is due to an infection, and typically by Staphylococcus infection of the world. And the reason why we have an infection of the lacrimal sac, which is right here, when we have an infection of the lacrimal sac or inflammation of the lacrimal sac, this is seen as a complication from nasolacrimal duct obstruction. Let's look at the symptoms a patient with acute Dacryocystitis would have. First of all, as we see from the picture that we saw just recently, the patient would have a tender, red, warm lacrimal swelling right here in the medial epicanthus or below it. And the swelling consists of pus. So if you press it, there can be regurgitation and leakage of further mucopurulent discharge. Or they might say it as epiphoria, the same meaning, but mucopurulent discharge or sticky discharge. Not just that, but the patient would also have fever. So all of these symptoms in type of edema, especially around the lower and the upper eyelid being involved, all of this give you the signs and symptoms of an acute infection in the form of acute Dacryocystitis. So this is the case right there. And of course it occurred recently. And of course, if you want to revise, remember the lacrimal system, the one that secretes your tears really, or the ones that lubricate your, eyeball is the lacrimal system. So this is the lacrimal gland, and the lacrimal gland secretes its sting, and it will be covering the eyes. And then you use your eyelashes by blinking to lubricate your eyeball. And then from that point on, some of the tears are not going to be used, some of this water right here, are basically going to be drained through the nasolacrimal duct. It will go through something called as the punctum, then the caniculus, and then to this dilated swelling known as the lacrimal sac. From the lacrimal sac, it will go down to the nasolacrimal duct. Now, what would be abnormal here is if there was a way to cause an obstruction here. If there was an obstruction in this area right here, either congenital or acquired, then this will lead to stasis of the tears. The tears, they will be placed in they will be basically static. The tears will be just basically sitting up here, just staying here, not being drained. And some of them may leak out outside and cause epiphoria. Epiphoria is another word for tearing or watering or discharge, watery discharge. A lot of different words, but really some of it are the same meaning. So they may have excessive watering in their eye, as if they're crying, but they're not really crying, all right? So they might have that, and that's pretty much it, unless it causes infection. That's another thing. And that's what you gotta keep in mind. This is nasolacrimal duct obstruction. If there's an obstruction, this is nasolacrimal duct obstruction. It could be congenital or acquired. In the case of congenital nasolacrimal duct obstruction, basically this occurs in children who have congenital stenosis in the nasolacrimal duct for whatever reason. So you will have a baby approached to you by the mother that there's constant watering and tearing coming out of his eyes. Constant lacrimation coming out of his eyes. So what you will typically do, you'll do a dye disappearance test. You'll apply a dye to the eyes, and of course you'll see under the microscope a lot of lacrimal tears in the form of the color green. So you'll say, oh, this is pretty definitely might be congenital nasolacrimal duct obstruction, or there's a problem in drainage. You can also do probing. Probing basically means you insert a probe, a lacrimal probe here, and this can be both diagnostic and therapeutic. This can give an idea whether there's an obstruction here. If there is, it is a case of congenital NLD. If it isn't, then it's something else, okay? But typically probing isn't done immediate. Typically probing can be done later on. You can rely on the dye disappearance test and clinical diagnosis from the history, and do eye examination in general for any other symptoms. And you can assume this baby might have congenital nasolacrimal duct obstruction. Because here's the thing, typically the treatment in the case of congenital nasolacrimal duct obstruction, typically you give them topical antibiotics. Because like I said, the problem with NOD is there will be stasis of the tears. The tears will stay in their motion, and whenever there's stasis, especially tears or fluid, this can lead to risk of infection. So this can lead to development of infection and lead to inflammation of this lacrimal sac and cause what we know as acute Dacryocystitis or chronic Dacryocystitis, okay? So to prevent that, we can basically observe the patient. We can observe the patient and give them topical antibiotics for the first 6 months in a child, okay, in a baby. And then we'll see if it still persists, if it's still there, if it doesn't resolve itself, if there's no recanalization of this area right here, then in that case, we can do probing. We can apply a probe here. Basically, we can apply a probe to this area, and it can be both diagnostic and, as like I said, diagnostic as well as therapeutic. It can open a hole here and allow for some of the tears to pass through. However, if it doesn't work, we can attempt it only 2 more times. If the probing doesn't work, and let's say we apply a stent here, a stent to open the gap in the nasolacrimal duct, if that doesn't work 2 times, then in that case, we would have to do, as last resort, DCR. We would have to do DCR, which is Dacryorhinostomy. Basically, you're gonna connect the nasolacrimal duct with your nose. You're gonna basically drain these tears. Instead of the nasolacrimal duct, it's gonna be drained from your nose. So that's Dacryorhinostomy. That is a last resort. But typically in congenital nasolacrimal duct obstruction, you'll just observe for like the first 6 months, and inshallah it will just resolve itself. Give them topical antibiotics. And also another thing you can do you can actually do, and actually recommend it, you can do lacrimal massage. You can basically massage the lacrimal sac right here. And this will basically, the idea behind this, you can create enough pressure to allow some of this tear to actually push through this obstruction. So you can do lacrimal massage as a first-line treatment and see what happens as the child grows. Okay? This is regarding congenital nasolacrimal duct obstruction. Of course, if it's untreated, if it doesn't work, if it's untreated as it is, well, the complication of nasolacrimal duct obstruction is Dacryocystitis, and the treatment will be the same. Okay? In the case of acquired nasolacrimal duct obstruction, it's the same. Someone has nasolacrimal duct obstruction due to sarcoidosis or any granulomatous disease or TB. So he'll have the same issue, and it can lead to, again, acute Dacryocystitis. In the case of acute Dacryocystitis, the treatment for this bad boy is DCR immediately. You will never do probing for Dacryocystitis, because if you insert a probe in the nasolacrimal duct in Dacryocystitis with an inflamed red lacrimal swelling, you will spread the bacteria to other places. So you will never do probing. But you can give the patient antibiotics, to relieve or calm the swelling, and then do DCR immediately. You have to do Dacryorhinostomy immediately afterwards, okay? So that is the treatment for Dacryocystitis, whether acute or chronic. And as we mentioned before, the investigation for it is really clinical diagnosis for Dacryocystitis, and you can do a positive regurgitation test where you just press on the lacrimal swelling, if there's regurgitation, if there's any pus coming out of it. And that's pretty much it. There's nothing more to it than that. This is for the case of really nasolacrimal duct system, and I hope you enjoy it.